available for this. Okay. And thank you again. Is everybody listening? Am I okay now?
Yes, you are.
Okay, very good. So thank you again. And as you were saying, so my training is in surgical oncology. Just to add on, I did also a fellowship at Moffitt Cancer Center, which happens to be the capital of skin cancer. So I spent 2 years there and did a lot of research over there. We're now here in San Antonio, where we help the community through Tex Oncology. Let's look at the next slide. My next slide is not moving forward. Oh, went too fast. 1 second. There you go. Very good. So just briefly about Tex Oncology, it's probably the largest cancer center we put all together through all Texas. With more than 500 physicians, we have more than 220 locations, but overall think as the busiest and the community cancer center that takes care of more Texans than any other of the big places. I train at MD Anderson, and we still, as Tex Oncology, as a community, we treat more patients than MD Anderson. We have all specialties from surgical oncology, gynecology oncology, medical oncology, urology, breast oncologists, colorectal, obviously medical oncology. So we're very, comprehensive when it comes to cancer care, and so we're delighted to take care of our patients in the community. That's our main goal with cancer. As you can see, also we are very involved with significant amount of drugs that have been approved for cancer treatment, and most of these drugs now became a gold standard for many of the cancers. Melanoma, one of those, like Opdivo and breast cancer, and many of these were through trials done through Tex Oncology in the community, and then they are now available through the whole world. And so just to give you an idea that we also are very active when it comes to, cancer therapies in the development of these drugs. And so, as I mentioned to you, we're very important for the community. Cancer is very prevalent in the United States. In 2022, more than almost 2 million new cancer cases will be diagnosed in the United States. And a significant amount of those are here in Texas, with more than 100,000 per year. And so still cancer has a lot of impact when it comes to mortality. Many years ago, it was not as prevalent, but now it's prevalent, it's common, but also it's one of the third or the second most common cause of death in the United States. So the incidence of cancer is going up, and mortality is prevalent still on patients with cancer. I'm gonna now devote this few minutes about skin cancer statistics. And first of all, skin cancer is very common. It's the most common cancer in the world, and it's the most common cancer in the United States. The good news about skin cancer, although it's very common, is not very lethal. At least 20% of Americans will develop skin cancer by age 70. Skin cancer, traditionally speaking, we see it more after age 65, and the older the patient gets, 70s, 80s, the risk of having skin cancer is very high. One of the cancers that I treat that is not very common, it's melanoma. And of all the skin cancer, is not very common, but in contrary to the other cancers, this one is more lethal. And so in the United States, almost 100,000 people will be diagnosed with melanoma. So it's prevalent, but not as prevalent as a whole when it comes to all skin cancers. Close to 5,000 melanoma cases are expected in Texas just this year. And as I mentioned to you, the other non-melanoma skin cancers are so prevalent, they're very difficult to estimate. Many patients will not go and have a biopsy or be treated because they're very indolent, they're small, and they don't want to be seen by a doctor. But most of these represent squamous cell carcinoma or basal cell carcinomas, and the mortality of these cancers is very low. One of the risk factors, those who use indoor tanning beds, 83% more likely to be diagnosed with squamous cell carcinoma and 29% more likely to be diagnosed with basal cell carcinoma. So most of the skin cancer in the world is due to sun exposure. And that's what has been traditionally the most common risk factor. And this is the sun exposure that was done through light. But nowadays we see these tanning beds that over the last years have been more prevalent in certain communities. And they have also been, involved with the risk factor for squamous cell carcinoma, basal cell carcinoma, as well as melanoma. The most common risk factors I mentioned to you is UV light exposure, sunlight and lamps. And most of the time, this is the exposure that was done when patients were young, when they were kids and they were going to the river, to the lake, to the beach, or they were going to the pool without any protection. And that was very common, many years ago. And that exposure is what over time will lead to skin cancer when patients get to be 70, 60, 80. Indoor tanning, as I mentioned to you, there's a component of family history, and family history is rare when it comes to a gene, but there's some genes that are involved with melanoma. But when we hear about family history, it's mainly because they have the same background. For instance, they were farmers, or like fishing or some activities, outdoor activities that as a family has been done for many years. And so they share this sun exposure. And because of that, family history is linked to the skin cancer. A personal history, so a patient who develops melanoma, squamous cell, basal cell in the head and neck area and the hands, they're always at risk of developing another one. And so once a patient is being diagnosed with melanoma, I always tell them, protect your skin because another one can come. The same happens for squamous, the same happens for basal cell. The type of skin is also a risk factor. Those who with fair skin are the highest risk. And so that's very commonly seen. And so we have to be aware of that. But everybody that, regardless of the type of skin, is exposed to UV light is at risk of developing cancer. It's important to have this idea because all of us have moles and may be present for decades. And the question is, so when do I go see a doctor, or when do I need a biopsy? How do I know I need to see a dermatologist? So we have this ABCDEs on, some of these skin lesions, and melanoma is probably the most common example of how things can change. We can have a dark, round, smooth mole, but with time, it changes the way it looks. We call that asymmetry. It starts to look different in size, shape, and color and thickness, maybe flat. Now it's not flat. Sometimes the borders are not as smooth as before. There's also change in the color to be, getting darker or being more pale. And those are also important to be aware. Size, obviously, as the mole starts to getting bigger, and changes that we see rarely, we have seen some melanomas that patients noted because the mole's been there for years, but now it's itching, or now it's bleeding, or feels different. So I think this is very important to be aware. As me educating the community, I think this is the most important slide that I can show you today, is if you have a mole that you have for years, you're concerned, take a look at these images. And if you see any of these ABCDEs, this is a time to go see a dermatologist. Some prevention that we can do. We all have been exposed to the sun as kids, on a daily basis. So what can we do if we're aware of some family history, or I work outside farming, or I all day like to be on the weekend on the beach or the pool. So what can I do to help? So always limit your exposure to UV light. We know that the strongest is between 10 a.m. and 4 p.m. So try to go early in the morning to do your running, or after 4 p.m. All those outdoor activities, try to be aware of the timing of your exposure. Obviously, protect your skin. Sunscreen is very important. And try to protect your, use a hat, your hands as much as you can. This is very important. Wear sunglasses. So these are basic things that we probably do all the time, but be aware at least of the time If you like to be outdoors, avoid between 10 a.m. and 4 p.m. And obviously avoid time in beds. They're well known to increase the risk of cancer. When it comes to the types of skin cancer, there are several, and as I mentioned to you, the most common may be basal cell squamous cell carcinoma, but the ones that are more dangerous is the melanoma. And there are others like Merkel cell carcinoma. But as you can see here on the images, a dark mole that's changing in size, those are the way melanoma looks. And so those that look like more like a pink bubble, those are more like basal cell carcinoma. And it can happen anywhere. It can happen, even the sole of the feet, it can happen in the hands and back of the neck. And so it's very important to have a good check on this of the whole skin. Basal cell carcinoma, this is a classic picture you can see on the bottom. It's not dark, it's not pigmented, looks like a little raised, and with a divot in the center. They have this pearly appearance, and they're very commonly seen on the face. This is a basal cell carcinoma, very common, usually 865, 75, 80, small. They're very small, and they rarely metastasize, meaning that they rarely will have an impact on mortality. And so, but they're very common. And so the nose is a very common place where we see these two. Squamous cell carcinoma, they have very different appearance, as you can see here, very commonly seen on the ear, on the hands. We can see it also on the shoulder, on the upper back, and they look like a crustus in there with a very rough surface. Sometimes they're flat and with reddish patches. And also, this is rarely a cause of metastasis, meaning that it travels to other parts of the body, but it can also cause significant morbidity with requiring surgery. And rarely we do see these two spread to the lymph nodes, but that's usually on patients with very large squamous cell carcinomas who pretty much have been neglected. We see it also on the lip. You can see here in this image on the lip. So the lower lip is the most commonly affected, and that's also a reason to protect your lips when you're outdoors at all times. There are some lesions that not necessarily are cancer, like actinic keratosis. They look very similar, as you can see from the images, as squamous cell carcinoma. The most common places will be, the scalp is very common on men, on the scalp and on the hands, sometimes on the face, but sometimes they itch, and it's important that won't be misdiagnosed with squamous cell carcinoma, and they need to be biopsied and treated accordingly. So what are the treatment options? So most of these are small, and if the patient has the opportunity to have a good primary care doctor, a good dermatology evaluation, some of them can be treated with very simple minor surgery, and sometimes medication depending on location and depending on comorbidities. Sometimes this happen on patients who are elderly, 80s, 85, multiple comorbidities. So we want to do a minimum on this type of patients. And the treatment depends, obviously, if it's in the nose, if it's in the scalp, hands. So, but the bottom line is that these are most of the time treated with a simple surgery. Sometimes radiation can be done, in particular in places where surgery may be very morbid, meaning like it can cause more difference in quality of life. So a small radiation can be done. And immunotherapy and chemotherapy, that's mainly treatment that we do for advanced cancer, in particular melanoma, who has metastasized to the lymph nodes or to other parts of the body. And that represent a small percent of patients with melanoma. But if we group all patients in general with skin cancer, the majority will not require any of these more aggressive treatments. And still surgery represents the most important treatment, but I think awareness, going to see your dermatology, protection, that will be the ideal, so that if it happens, it's small and can be treated with minor surgery. And when it comes to early stage basal cell and squamous cell, so a small surgery can be done, cryosurgery, and this most of the time are done by dermatology. I am a surgical oncologist, so I can treat them all, but I get to treat the more advanced, the ones that goes to the lymph nodes or very large areas. But most of these cancers are treated in the office. You know, a primary care doctor can do a simple surgery with local anesthesia or dermatology or through Mohs surgery. When it comes to melanoma, then it becomes a little bit more challenge depending on the depth. We not only remove the skin cancer, but also do something called sentinel lymph node biopsy. You can see in the slide where we sample lymph nodes. And depending on that, that's the most important predictor of survivorship. We'll do immunotherapy, chemotherapy, and also radiation for locally advanced or multiple lymph node involvement. There's some myths and facts about skin cancer. One of the myths is the sun is not out, or if it is cold, that there is no risk from sun's damaging rays, and that's not true. You can go and do some, go to Montana or go to Colorado where it's cold and beautiful snow, and you will get a big burn. And so the bottom line is, if you're outdoors, doesn't matter, the UV will go through the clouds, or it doesn't matter, you have to be protected, as I mentioned. And so the UV can penetrate the clouds, and doesn't matter, how the weather is outside. So be aware that here in Texas, here in San Antonio, we love to go to the lake, to the river, and tubing, and even water can also, be affected and reflect the sun's rays and also give you a higher exposure. Skin cancer is not a deadly disease, as one of the myths. I would say that's for the majority of cancers. We don't know the exact amount of skin cancer because it's very prevalent, but despite that, a subset of patients, still will die of cancer. Most of them are melanomas. Most of them might be Merkel cell carcinoma, but in the United States, more than 12,000 people die of skin cancer. So the awareness, for instance, of this type of talks it's for all skin cancers, but the main awareness is for the cancer that may be more lethal, like melanoma. Skin cancer only affects Caucasians and those with lighter skin. So I commonly see acral melanoma. That's very common among Hispanics and African American. And the truth is that skin cancer, happens, in every type of skin, as I mentioned. Even those more prevalent, those with lighter skin, everybody has to protect their skin when they're outdoors, okay? The problem with melanoma is that even though it's less commonly seen among Black, Hispanic, or Asian, when we found it, it's more advanced, like acral melanoma, and tend to have lymph node metastasis, and therefore the mortality is higher in this group of patients. Another myth is that you need to apply sunscreen only once a day. And the truth is that no, you have to do it as much as you can, okay? Reapply every 2 hours, and be aware, sometimes we do it in the morning, go outdoors, and then that's it for the day. But no, you have to be aware that the more you do it, the better for your skin. What are the tips to remember? Try to do your self-exams monthly, particularly the areas that are more exposed to the sun, the face, the head and neck, the hands. Be aware of the back. That's also a very common place for basal and squamous cell carcinoma. Your primary care doctor can send you to see a dermatologist. So I would say there's a family history, or you're one of those exposed to a lot of sun. And I would say after age 50, 60, dermatology should be a yearly exam. And obviously, if you see any changes in your skin, the mole who has been present for years, and all of a sudden looks a little bit different, even though it's the color or the size, please go see your primary care doctor, okay? Avoid tanning beds. That's very important, and wear sunscreen at all times. Very good. Thank you very much for all your time today. I'll be delighted to answer any questions.